Welcome to Destination Change, a podcast where we talk recovery, treatment, and more. I'm your host, Angie Feather-Sutton, with the National Behavioral Health Association of Providers, and I use she, her pronouns. My guest today is Nick Jaworski. Nick is an internationally recognized executive in the field of behavioral health marketing and operational consulting, with experience building organizations across 4 continents. As the owner of Circle Social, Inc., he has helped healthcare organizations ranging in revenue from $10 million to $300 million a year perform turnarounds and accelerate growth. He is a recipient of the prestigious Jefferson Award for his work in mental health, is an advisor to the board to NBHAP, and is also on the board to one of the most innovative treatment programs in the country, Above and Beyond Recovery in Chicago. When he's not online, he can be found spending time with his favorite person in the whole world, his daughter. Thank you very much for joining us today, Nick.
Angie, thanks for having me. I really appreciate it.
Now, I always like to start the podcast with kind of what I've called origin stories. Basically, what got you into the industry, why mental health, behavioral health versus all the other industries. And for you specifically, the dual one, why marketing versus, accounting or something like that?
Sure. That's a pretty long story. I'll try to give a short version. Start maybe with the marketing piece because that's easier. So I actually lived abroad, as it said in that nice bio you gave me there, international. So I've done about 10 years of work abroad in China, Turkey, Vietnam, obviously the US, other places. And through my work internationally, I ended up building a couple personal profiles as well as companies through online media and marketing. And then that got me into a lot of training situations and then startups and then turnarounds, kind of through the awareness that was built in my work in those areas. And so I became known as a turnaround specialist from an operations standpoint. And a lot of what I had to do, both internationally and here in the US, was marketing work. So I became very adept at marketing. And back then, that was more educational institutions. Coming into the US eventually, when was that, man? Back in 2014, I think I came back to the US. I then stayed in education for a little while and eventually decided to branch out on my own. So that was kind of the marketing piece, just lots of experience in a variety of settings on different platforms and different languages and cultures, and just really understand how marketing works. And then being very effective at it, I found the opportunity to obviously branch out on my own rather than doing it for other people. So that's what I did. And then when we started the company, when I started Circle Social, we were kind of a jack of all trades, like a lot of marketing agencies are. A lot of agencies stay that way. Very quickly in the history of Circle Social, I didn't want to stay that way. It's very hard to become good at other industries. Sometimes people think marketing is marketing. That's absolutely not true. That's like saying a doctor is a doctor or a teacher is a teacher. My shop class teacher can't teach my chemistry class. My heart surgeon can't act as a dentist or provide podiatry services, right? So marketing is very similar. Just because you can market a car dealership or a roofing company doesn't mean that you can market healthcare. And even within healthcare, marketing for hospitals is radically different than marketing for dental organizations, which is different than marketing for behavioral health providers. MAT marketing is radically different from residential and IOP marketing. Lots and lots of differences. So I wanted us to become really good at what we were doing. We had started working with a couple rehab providers early on, good people. And then just part of my personal backstory, I went through treatment when I was like 18, 19, something like that. And so I had a personal passion around it. And I also recognized there was an opportunity to improve the space and make it better. I had a certain professional background that I was bringing to the table. And a lot of people, especially back then when we first got involved, a lot of people with really good hearts that maybe had gone through recovery themselves and decided to open a treatment center, but without a lot of experience in the business world, in the world of marketing, et cetera. And that was also back when there was a lot of negativity in the marketing space. So a lot of people engaging in very shady practices, which, as we just saw, the FTC just came down on Evoke Wellness for some shady marketing practices. So it's still continuing, but it was rampant back then and almost blatant. People were doing it out in the open. So that really upset me, as someone that went through treatment myself and wanted people to find quality care. So we decided to go all in on behavioral health just out of that personal passion. There's rewards in getting up in the morning. Yeah, we can market e-commerce or we could figure out roofing companies or whatever, but that's just not as motivating personally to me and to the entire team that we've built here at Circle Social. The reason people stay with us by and large is not because we support them and they learn a lot. That's part of it, but they really love the work that we do. There's a lot of passion around it. And so that's what really brought me into the space kind of full time.
Why the name Circle Social? What's the origin of that, out of curiosity?
Yeah. I do get asked that quite a bit. It's just really two aspects: social media. So marketing is very driven by building trust. Your core of what you're trying to do from a marketing campaign is to get people to trust you and your organization to deliver them the thing that they want or the thing that they need. It's not just about awareness. It's not about eyeballs, right? I need to build trust so that person says, you're the organization I want to go to for X, whether that's treatment or mental health services or MAT or dental work. It's a trust-based platform. So that social aspect is key to everything that we do. And then the circle is just kind of unity, and it all kind of flows together. My marketing doesn't work if my call team doesn't support what the marketing team is doing. BD doesn't work if they don't have marketing support. None of it works if they don't understand clinical, right? So that concept of kind of wholeness within a circle was part of the thought process.
Now, I know that the ethical marketing is actually one of the core points of why NBHAP was created. And we developed the Certificate Addiction Treatment Marketing, which is now the CAMS, which is Certified Admissions and Marketing Specialist Program. Let's talk a little bit more about what does it mean to market ethically in the behavioral health world? What are you trying to achieve? Why is that a problem? That kind of stuff.
So I think first and foremost, we want patients connected to quality care that's right for them. And so that's really the heart of everything. And that's what we've built at Circle Social. And that's why a lot of people work with us, because they've seen that focus on connection to quality care. And so without even getting into like the blatant shady practices that happen, at the end of the day, if I can find a program that works for them, a program that's doing just teen girls is going often to be a better fit, if that makes sense from a geographic standpoint, the cost standpoint, et cetera, than maybe a program that's a mix. But for some people, a co-ed mix is a better fit for them. They're more comfortable in a co-ed setting than they would be in a girls-only setting, because we've heard this from patients, girls can get catty and it can be difficult. Yeah. But that depends on the patient, right? So patients have preferences, they have needs. And so first and foremost, it's getting people to the right care. And what was happening, and what still happens sometimes, even in the Evoke case with the FTC right now, is you were calling a generic treatment center and they weren't being referred to a program because it was the best fit for them. They were being referred to a program because it was the most money that they were getting when selling that lead, or it was the most money they were getting from a reimbursement standpoint. So rather than giving them care in
Welcome to Destination Change, a podcast where we talk recovery, treatment, and more. I'm your host, Angie Feather-Sutton, with the National Behavioral Health Association of Providers, and I use she, her pronouns. My guest today is Nick Jaworski. Nick is an internationally recognized executive in the field of behavioral health marketing and operational consulting, with experience building organizations across 4 continents. As the owner of Circle Social, Inc., he has helped healthcare organizations ranging in revenue from $10 million to $300 million a year perform turnarounds and accelerate growth. He is a recipient of the prestigious Jefferson Award for his work in mental health, is an advisor to the board to NBHAP, and is also on the board to one of the most innovative treatment programs in the country, Above and Beyond Recovery in Chicago. When he's not online, he can be found spending time with his favorite person in the whole world, his daughter. Thank you very much for joining us today, Nick.
Angie, thanks for having me. I really appreciate it.
Now, I always like to start the podcast with kind of what I've called origin stories. Basically, what got you into the industry, why mental health, behavioral health versus all the other industries. And for you specifically, the dual one, why marketing versus, accounting or something like that?
Sure. That's a pretty long story. I'll try to give a short version. Start maybe with the marketing piece, because that's easier. So I actually lived abroad, as it said in that nice bio you gave me there, international. So I've done about 10 years of work abroad in China, Turkey, Vietnam, obviously the US, other places. And through my work internationally, I ended up building a couple personal profiles as well as companies through online media and marketing. And then that got me into a lot of training situations, and then startups, and then turnarounds, kind of through the awareness that was built in my work in those areas. And so I became known as a turnaround specialist from an operations standpoint. And a lot of what I had to do, both internationally and here in the US, was marketing work. So I became very adept at marketing. And back then, that was more educational institutions. Coming into the US eventually, when was that, man? Back in 2014, I think I came back to the US. I then stayed in education for a little while and eventually decided to branch out on my own. So that was kind of the marketing piece, just lots of experience in a variety of settings on different platforms and different languages and cultures, and just really understand how marketing works. And then being very effective at it, I found the opportunity to obviously branch out on my own rather than doing it for other people. So that's what I did. And then when we started the company, when I started Circle Social, we were kind of a jack of all trades, like a lot of marketing agencies are. A lot of agencies stay that way. Very quickly in the history of Circle Social, I didn't want to stay that way. It's very hard to become good at other industries. Sometimes people think marketing is marketing. That's absolutely not true. That's like saying a doctor is a doctor or a teacher is a teacher. My shop class teacher can't teach my chemistry class. My heart surgeon can't act as a dentist or provide podiatry services, right? So marketing is very similar. Just because you can market car dealership or a roofing company doesn't mean that you can market healthcare. And even within healthcare, marketing for hospitals is radically different than marketing for dental organizations, which is different than marketing for behavioral health providers. MAT marketing is radically different from residential and IOP marketing. Lots and lots of differences. So I wanted us to become really good at what we were doing. We had started working with a couple rehab providers early on, good people. And then just part of my personal backstory, I went through treatment when I was like 18, 19, something like that. And so I had a personal passion around it. And I also recognized there was an opportunity to improve the space and make it better. I had a certain professional background that I was bringing to the table. And a lot of people, especially back then when we first got involved, a lot of people with really good hearts that maybe they'd gone through recovery themselves and decided to open a treatment center, but without a lot of experience in the business world, in the world of marketing, et cetera. And that was also back when there was a lot of negativity in the marketing space. So a lot of people engaging in very shady practices, which, as we just saw, the FTC just came down on Evoke Wellness for some shady marketing practices. So it's still continuing, but it was rampant back then and almost blatant. People were doing it out in the open. So that really upset me, someone that went through treatment myself and wanted people to find quality care. So we decided to go all in on behavioral health just out of that personal passion. There's rewards in getting up in the morning. Yeah, we can market e-commerce or we could figure out roofing companies or whatever, but that's just not as motivating personally to me and to the entire team that we've built here at Circle Social. The reason people stay with us by and large is not because we support them and they learn a lot. That's part of it, but they really love the work that we do. There's a lot of passion around it. And so that's what really brought me into the space kind of full time.
Why the name Circle Social? What's the origin of that, out of curiosity?
Yeah, I do get asked that quite a bit. It's just really two aspects, social media. So marketing is very driven by building trust. Your core of what you're trying to do from a marketing campaign is to get people to trust you and your organization to deliver them the thing that they want or the thing that they need. It's not just about awareness. It's not about eyeballs, right? I need to build trust so that person says, you're the organization I want to go to for X, whether that's treatment or mental health services or MAT or dental work. It's a trust-based platform. So that social aspect is key to everything that we do. And then the circle is just kind of unity and it all kind of flows together. My marketing doesn't work if my call team doesn't support what the marketing team is doing. BD doesn't work if they don't have marketing support. None of it works if they don't understand clinical, right? So that concept of kind of wholeness within a circle was part of the thought process.
Now, I know that the ethical marketing is actually one of the core points of why NBHAP was created. And we developed the Certificate Addiction Treatment Marketing, which is now the CAMS, which is Certified Admissions and Marketing Specialist Program. Let's talk a little bit more about what does it mean to market ethically in the behavioral health world? What are you trying to achieve? Why is that a problem? That kind of stuff.
So I think first and foremost, we want patients connected to quality care that's right for them. And so that's really the heart of everything. And that's That's what we've built at Circle Social. And that's why a lot of people work with us, because they've seen that focus on connection to quality care. And so without even getting into like the blatant shady practices that happen, at the end of the day, if I can find a program that works for them, a program that's doing just teen girls is going often to be a better fit, if that makes sense from a geographic standpoint, the cost standpoint, et cetera, than maybe a program that's a mix. But for some people, a co-ed mix is a better fit for them. They're more comfortable in a co-ed setting than they would be in a girls only setting, because we've heard this from patients, girls can get catty and it can be difficult. Yeah. But that depends on the patient, right? So patients have preferences, they have needs. And so first and foremost, it's getting people to the right care. And what was happening and what still happens sometimes, even in the Evoke case with the FTC right now, is you were calling a generic treatment center and they weren't being referred to a program because it was the best fit for them. They were being referred to a program because it was the most money that they were getting when selling that lead, or it was the most money they were getting from a reimbursement standpoint. So rather than giving them care in Massachusetts, maybe they're flying them to Florida because Florida is giving them better reimbursement rates. That is not ethical marketing. Even if you're running a legitimate Google Ads campaign, but you're moving people around based on the financing that you're going to get rather than the screen and the assessment that tells you what the best fit for them is going to be, I would also consider that not to be, fully ethical. So that's the starting point. Are we sending people to the place that's going to get them the best fit for them? And there's lots, again, like that. It could be the clinical approach. It could be cost. It could be the insurances that are accepted. It could be location based, so family can visit or it's easy for them to get to. There's lots of different factors that drive that, but that's number one. And then obviously, don't do the shady stuff. I mean, people get away with it for a while, and so then they think it's okay. And just because you're getting away with it doesn't mean it's okay.
Yeah.
I'm really happy to see the progress we made in the space. As painful as legit script is to get and annoying as that process can be sometimes, it was great. It was great for the field. It really cleaned up the field significantly. I think as these FTC cases come in, that'll clean up the field more. The laws pass around patient brokering. I mean, we know patient brokering still happens, but it's significantly reduced, and it's much more, at least it's forced under the table. At least it's not, so rampant. So all those things.
Yeah. Now, I don't want you to give away all your secrets, but I do know that your website offers resources as well as like a blog and whatnot. So kind of what are some of the things that you've written about that are on there that you would give as suggestions for someone who wants to do some marketing?
We're very open with what works and what doesn't work in the field. I think people value that from us. We're very willing to share what KPIs and benchmarks, what good content looks like. And part of the reason that we're willing to do that is because there's a massive difference between knowing something and being able to do it well, right? I could read a book on heart surgery, but that doesn't mean that I should be going and giving people open heart surgery, right? Nor would you want me to give you open heart surgery. It's very, very hard to do marketing well. And the bigger you get, the more complex it is. Making sure that the SEO team is aligned with the web development, is aligned with copywriting, is aligned with paid media campaigns. There's massive workflows and project management that has to go into that, on top of staying aligned with the client's goals and their particular reputation and their brand and the story that they're trying to tell. So it's very, very hard to do. So I'm not really worried with people copying us. Many people have tried. It's all in the execution. And then really important, I think, for listeners to understand is a lot of people think that marketing is some kind of like independent, siloed entity that just gets results by magic on its own if you do it well. And that's 100% inaccurate. I can't copy a campaign. And so let's use something that's a little bit more familiar maybe to everyone. Let's use Starbucks. If I take a Starbucks ad, copy paste the entire ad, and then switch out the logo and run it for Joe's coffee shop down the street, it's not going to work. Think about you looking at two ads. You see two ads, they're exactly the same, but one is for Starbucks and one's for Joe's coffee shop. Which one are you going to go to? You're going to go to the Starbucks one because you trust them, right? It's already established. You know the service you're going to get, the quality coffee, the costs that are going to be there. There's consistency in their execution. They execute consistently the same way, and so you have a lot of trust in the value of that brand. Brand is just reputation at the end of the day. So really good marketing is about understanding what your client's differentiator is and then telling that story, effectively allocating capital to the right channels that are can convert in the right way. And you need a whole journey there, right? I can't just run a Google Ads campaign. I need my business development outreach connected with my collateral, connected with my Facebook campaigns, connected with my Google Ads campaigns, connected with my SEO. All of that has to be aligned for there to be a cumulative effect. And all of it is ultimately driven by the differentiation. So in that sense, marketing is significantly dependent. We see it very much in our campaigns. We can take a similar approach. Let's say we've got two clients that really focus on trauma and they're very good at it. But one client has only been in the market for 2 months. They just opened up shop. Another client's been established in their market for 4 years. Our campaigns with the client that's been running for 4 years are significantly more effective. Why? Because people already know and trust that provider, where the new client, nobody knows them. Nobody knows if they can be trusted yet. So again, marketing is very dependent, and it's dependent based on what's different about a provider, not the commodity of treatment. Right? Just because you do addiction treatment services doesn't mean marketing can sell it, let's say. There's a whole process that is very much a virtuous loop, feedback loop between the reputation that you have in the community, the execution of the care that you give, and the marketing message that's sent out.
Now, this might be one of your marketing secrets, so by all means, tell me that and don't answer. But what do you deal with the catch-22 of you can't have people trust you unless you get services, but you can't get services unless people trust you, kind of thing?
It's a great question. And the reality that we always tell clients is it's expensive. You've got to be willing to spend a lot more money. As I just said, the established trauma treatment provider, our campaigns are going to be 2 to 3 times more effective than a new treatment provider's campaigns. Yeah, I was just talking to, interesting enough, we had a treatment group in India. They've got about 7 facilities in India. They're trying to expand. They want to do some more international expansions. And same situation there. They want to go into new markets. The only way to do that is to spend a ton of money. And I'm very upfront. Oftentimes, that is money spent at a loss. You're not actually going to make money on your initial marketing spends. You're just spending to really try and convince people to get in the door. Now, normally in a normal marketing campaign, if you introduce a new product, it's the same thing. You often run marketing at a loss because not only are you paying for the marketing, but you run it at a discount and say, hey, look, you want to try us. You know the competitor. You know the competitor is good. You trust them. I want you to give us a try. So here's a 20% off coupon. Why not give us a shot? And then when they try you, they're like, oh, this is great. I will totally switch my preference. You can't do that in healthcare, right? There's laws around kickbacks and discounts and all these things, insurance contracts. We can't offer discounted treatment. So what we have to do is really focus on the differentiation piece and then just really push it out there to make sure we're getting in front of people as much as possible, be willing to give them or have them give our clients a try. Then once we start to get people in the door, then our overall cost per admission is going to come down because we're going to start to build that reputation. We're going to get good Google reviews. We're going to get more referrals. And so that's how you have to think about marketing. At first, it's always more expensive. And so based in your pro forma and your business plan is the assumption that marketing is going to be a losing cost to get a return later. And then once you've got an established organization, then obviously you have to make sure that your marketing campaigns are profitable and there's a clear ROI there. But in the beginning, it's often not the case.
Now, I'm in marketing myself somewhat. I've had marketing experience. I know that especially nowadays, social media is kind of going through a big change. What with X kind of backing off, and Facebook's changing their privacy things. We've got new Blue Sky and Mastodon, all these new ones coming out trying to compete. What are some of your suggestions for how important is social media to marketing and how to kind of keep abreast of that?
Yeah. So I think the simplest answer there is you need to be where your audience is. And so that determines your channel strategy and then obviously budget on top of that. So sometimes you'll hear things from people like Facebook doesn't work or TV doesn't work or Google ads don't work for us. There's no such thing. If your audience is there, then that is a channel that you need to be on. Maybe you don't understand that channel. Maybe you're not messaging on that channel appropriately. Maybe you're not reaching the right people on that channel, right? So there are many things you can be doing wrong to get a bad result. But at the end of the day, if your audience is there, it's going to work. And so in behavioral health, our audience is almost everywhere. Now you can tier that strategy, right? So what's one place where a lot of people with substance use and behavioral health issues end up? The hospital. And so that's a really good place for our outreach teams to go and for us to market to that staff on LinkedIn campaigns. Very effective because we know that there's a lot of people that go there. Google's the same thing, right? So when we can target by keyword, if we target by someone searching for addiction treatment near me or counseling services near me, Google is basically feeding us the people that are looking specifically for our services. So they've done the work for us of kind of sorting through that, but there's a cost benefit analysis there. Google charges through the nose for that high focused, high intent targeting. Whereas if you go on Facebook or X, I can pay a $10 CPM. I can reach 1,000 people for $10. That's insanely cheap. So even if I only get, one or two people converting to a call off of a Facebook campaign, I'm not paying anything for it. So I pay through the nose for Google for a high intent call. And then on something like Facebook, I'm paying for a lot of impressions and a small number of individual calls. But the cost comparison is Facebook's actually cheaper at the end of the day. So it really comes down to audience and understanding where they are. And then just making sure that you have the right message and the right targeting in place on those platforms and the right expectations. So like one thing we'll see with Facebook, for example, when we take over campaigns is they were running like some direct response campaign, like call us now. Who the heck is on Facebook being like, oh yeah, I'm just going to stop what I'm doing and call for addiction treatment? That's like seeing a car ad, stopping what you're doing, going to the dealership and buying a car. Nobody does that. That's not how marketing is supposed to work on those platforms. So you have to understand the function of the platform, and the function of a platform like Facebook is to nurture awareness and build reputation over time so that as people decide tomorrow and next week and next month that they need treatment, that they're going to be going to you rather than going to Google and potentially coming across your competitors' Google Ads campaigns and calling them, So all of these channels work together, but they work together strategically. You have to understand what each channel does, how it operates, what a successful campaign looks like and what the metrics are. And those metrics are not always calls. They're often not calls, actually. I mean, Google and your SEO work are the only thing where you can really kind of generate direct calls. Even with SEO, where'd the calls come from? They heard about you somewhere. Part of it's coming from your rankings. If you're doing really well and ranking on Google, that's going to get you a certain amount of volume. But then a lot of it's coming from your reputation in the community. It's coming from word of mouth referrals. It's coming from your Facebook campaigns. It's coming from your TV campaigns. So separating out what your SEO is doing versus your Facebook versus your TV, it's just kind of a fool's errand. People get really obsessed about that stuff. But at the end of the day, if I'm getting calls and people are coming into our care at a rate that is affordable in terms of our overall marketing spend, then that's how it works, right? Coca-Cola didn't build their company off Google Ads. Starbucks, the Mayo Clinic, Pfizer, right? All these massive multinational Fortune 500 companies don't sit there and look at their Google Ads call volume. They push out TV campaigns, Facebook campaigns, X campaigns, because they know that that's what drives their long-term sustainability, even if they can't get a 100% read on it. And then the last thing I would say is you really need to be running paid ads. So like when you look at social media, it's free, right? Posting to Facebook is free. Posting to TikTok is free. But how do these platforms make their money? They make it by selling ads. So they purposely throttle your reach on a social media platform. They're only going to give you 3 to maybe 5% reach of your total followers. So you're not getting much bang for the effort that you put into that. And then there's no restriction on it. So if I post a TikTok video and I'm a treatment provider in Nashville, Tennessee, well, who's going to see that TikTok video? People that are kind of interested. That's how the algorithm runs it, right? So you get people in New York, you get people in Canada, you're going to have people in China seeing your TikTok video. None of those people are really potential patients for you. Your patients are going to come from most often the Nashville area. So when you run an ad campaign, you can put in geofencing and targeting there and say, I'd only want to advertise to Nashville, right? I can't do that when I make an organic TikTok or a Facebook post. So organic posting is, you want to have a presence, when people see your page, and it gives you a little something, but it's not effective from a return on time investment standpoint. You want a minimum amount of time spent on your social media organic posting and you want more effort on your paid media campaigns.
Now, you've been doing this for a while, and like I said, I have a marketing background too. I remember back when you still had to convince people that having a website was a good idea back when those were still new.
Yeah.
Kind of on the tail of that last question, would you say marketing is harder now or just different than it was back when you just did radio ads, TV ads, and newspaper ads kind of thing?
Yeah, that's a great question. I would say it's just different. We had the same issue. I mean, I remember talking to CEOs when we first started, and they're like, what do you mean marketing on Facebook? Like, I don't understand that. That's the stuff for the millennials. I'll like hire like a college intern who will do our Facebook for us. No thanks, we're good. Which was just shocking to me because the results that we got on it back in the day were phenomenal. But why did we get such phenomenal results originally? It's because no one else was playing there. And you had a lot of attention. So I can't get anyone to move forward and build trust or take action unless they're paying attention to us, right? So they have to pay attention to the ad first. And then we can hopefully get them to take continuing steps. Well, because no one was advertising on Facebook early on, when you saw a Facebook ad, you were like, oh, that's kind of interesting. What's going on there? You had people's attention to a much more significant degree. The same thing happened with email. When you first started running email campaigns, everyone checked their email and all emails were important. It wasn't like today where we're bombarded by spam emails. So email is a burden rather than a benefit. So because you had focused attention, email campaigns were insanely effective when it first came out, just like Facebook was insanely effective. Plus, it was cheap. I mean, we used to have CPMs. They were about like $2 CPMs when I first started on Facebook campaigns. We even got individual Facebook reps. Like now you can't get a live person at Facebook for the life of you. You got to be spending $1 million a month minimum to get a real Facebook rep. It's not like those reps that contact you. Those are all like contractors and they're actually more salespeople than reps. A real rep is $1 million a month for you to get them. But back in the day, we could spend $1,000 a month and get a rep. It was great. So anyway, that's really my perspective on the social media piece and how you should be thinking about it.
Now, your company also has a podcast, the Recovery Executive Podcast. Talk a little bit about kind of what was the origin of that? Why do you do it? And give me the elevator pitch about what it's about.
Yeah, so pretty much in the name, it's really the executive podcast for people that are trying to build and run treatment programs. And I think it's better described by people I've talked to. They consider it almost a de facto college course on the industry at this point. We cover everything from clinical care to building curriculums to business development and outreach to financial projections to modeling to mergers and acquisitions. So everything's kind of covered in the podcast at this point. Why did I start it? I started it just because it was interesting to me and it was something that I noticed was missing in the field. So there was a lot of information on, you can go to conferences and go to clinical therapy presentations, on how to deliver care, what care looks like, etc. No one was giving presentations on what good business development looked like. No one was giving presentations on what a good Google Ads campaign was or what good pro formas were for new business models. And so I recognized that gap. And so I just wanted to fill it. And the way that I run Circle Social and the way that we think about business in general is everything's about adding value. The more value that we create for other people, the better that we're going to do. Right? Why do you pay for anything? I'm going to buy a candy bar because I'm happy with the dollar I spent for the wonderful taste that I get. I'm going to buy that video game because I love it. You get the money back, right? Good business creates value that people are willing to pay for. And so on our end, we just create a ton of value through our blogs, through our research, through things like the podcast. And people see how good we are at what we do. And then that makes them want to work with us. So it ends up serving a business function on top of just the personal interest piece.
Now, you said you've gone through recovery yourself, correct? Obviously, that influences how you approach your marketing position. But one of the things we talk about in Destination Change is that recovery is a journey, not a straight line that you can go all over the place. So I like to ask people who've gone through recovery kind of what does it mean to you to go through treatment recovery and how does that impact the industry?
So on my end, actually, that's maybe potentially a loaded question. So I've always believed that there's multiple pathways to recovery, which was unique back when I went through, right? It was 12-step or nothing, right? 12-step or the highway was kind of the mentality really for the entire industry through almost 2018, we started to see small shifts in terms of multiple pathways to recovery. So I've always approached it as, recovery is how people define it for themselves and what works for them in their lives. And that's why I think good counseling and good behavioral health care is, whether it's addiction or for other disorders. And also, like, my experience going through treatment was not overly positive. It was fairly poorly run from a program standpoint. I didn't really see the people getting the help that they needed. And so I think there's continues to be opportunities in our space to really focus on the quality of our program. And that's why you hear me talk about quality all the time. Not only is it really important from a marketing standpoint, I can't market thin air. The better your program is, as I've said, the easier it is for us to market and the more results we're going to get together. But if you don't have much there, then it's much harder for us to do that. And obviously, it doesn't have as positive of an impact on the patients. A stat I often like to share is, like, if you look at the pharmaceutical research on the efficacy of things like SSRIs, your placebo effect is about 30%. Even a lot of the research that like William Miller conducted for motivational interviewing often found that if you put people on a wait list, about 50% of them will show a significant improvement. So that means 1 in 3, sometimes even 1 in 2 people are going to get better just from a placebo, just by the fact that they've taken some action, started to make positive steps in their life. This creates this positive feedback loop of like, okay, I've taken a positive action. So people respond to me positively. Good things happen. I feel better. I take more positive action. People respond more. This positive cycle that just one step can kind of get you moving in the right direction. And so that contributes to that placebo effect. But oftentimes we get overconfident in the field and we say, well, look, I talked to a bunch of my patients and they're doing wonderful. Well, right. But 30 to sometimes 50% of them would be doing great, even if you had never talked to them, even if you had just given them a sugar pill and say, hey, take this, go home, you'll feel better. So we really have to kind of raise the bar in the way that we look at our outcomes and deliver care and say, we have to create a more than 1 in 3, ideally more than 1 in 2. And that really shows efficacy from a programming standpoint. So that's how I think about kind of recovery. We need these multiple pathways. We have to think more about rather than just anecdotal kind of feedback, but really looking at the data, understanding, beating placebo effects and basic recovery rates and waiting list rates. And how do we meet people where they are? Because like I said, when I went through treatment, it did not meet my needs in any way, shape, or form. It just wasn't a good fit for me in the way that I was approached and the tools that I was provided. Doesn't mean it won't help other people, but for me, it wasn't there. So that multiple pathways piece and working together with the patients to find what their treatment goals are versus imposing them from the outside. That's a big thing, I think.
Right. Now, this is kind of a simple question, but not, if that makes sense. One of the things we've talked about in prior podcasts are the various barriers to move forward in treatment. And the ones that keep popping up, obviously, are the stigma and, the price of recovery. Mm-hmm. How would you recommend, how to incorporate that into your marketing?
To incorporate in the marketing.
Or would you?
Yeah. You know what? I guess I would answer that people are pretty familiar with the costs, and the costs were also comparable across the board. So whether you have the income level to do private pay, or you're just going to pay your deductible off of your in-network policy, that's the same across the board. So you don't really have to worry about competing with that. And again, you can't offer discounts. It's illegal. You can't waive deductibles. So that's not a potential differentiator. It's not a lever that you can pull. Everyone's in network with insurance these days, so that's not really a differentiator for anyone. We've run a lot of campaigns. Clients will ask us, so we just got a network with BCBS. So can we run campaigns for BCBS? There is almost no search volume across the country for people typing in counseling services with BCBS or addiction treatment with BCBS. That's not a thing. You can just run the Google Trends data. It's not there, So there's not a lot of value in terms of marketing specific insurance policies. You should just be in network with most people most of the time, and your cost structure should be set up to be appropriately profitable within the reimbursement rates that are common in your area. That's a much easier way to do things, right? Rather than trying to like cherry pick high paying policies. That's not a sustainable business model as we've seen again and again. So we don't really focus on the price piece. Even the free assessment and stuff like that, people used to run that stuff all the time. It's like, oh, your treatment could be free with insurance or free assessment. We have not seen anything in the data. We've tested that, and we do not get better click-through rates. We do not get cheaper cost per call costs by running those campaigns because people are pretty familiar with the cost of care. And again, it's not a differentiator. It's going to be the same everywhere they call. So what really differentiates your program is your ability to provide recovery outcomes. And that's what most people want to hear. Sometimes there's differentiation around amenities and luxury treatment and things like that. There's a certain demographic that's going to move towards that, or being able to use their laptop. That's important to them. It's a small portion of the market. So you'll get some conversions by offering that kind of differentiation, and then obviously making sure it's messaged in your marketing campaigns. But mostly it comes down to the quality of the clinical care. I want to know, is my family member or am I actually going to get better? Is this going to work for me? And oftentimes, like I said, there's a really strong subjective component. For some people, 12-step modalities, faith-based modalities work incredibly well. For other people, they don't work. For some people, MAT is a really important part of the recovery. For some people, it's not. And so by messaging appropriately, you attract the right people to call in the first place, which is going to make you more effective clinically because you're getting the right people in the right programs. And it actually also, good marketing always actually pushes away people that aren't a good fit. So yeah, at the end of the day, it's market your program rather than the cost.
Excuse me. Now, we already kind of touched on this, but I always like to ask, what is the biggest change you've seen in the industry and where do you see it going in the next few years?
A good question. I'd say the two biggest quick changes I've seen, one was legit script in the first place. That was a big change. Actually, I guess three. Another big one that happened like a year later was the acceptance, or at least the tolerance of MAT. That was a massive paradigm shift for the industry. And I'd say the last one is just the saturation in the space. So I was just at lunch today with a bunch of different treatment providers that meet on a monthly basis here in the Indianapolis area. There are more people that want to come to that lunch than we have seats available. There are so many treatment providers in any metropolitan area, in even most smaller suburban areas in the country. So what's really happened then is this significant need for, like I talked about, niching down or differentiating your program and standing out. Because treatment from a marketing standpoint has become almost a commodity. There's so much addiction treatment offered. There are so many counseling services available. I can pull up Google Maps and within 10 miles of my house, which is a quick drive, I can go to 15 different places. So you have to be able to talk to your prospective patient and tell them why they're going to come to you rather than the other 14 people that are literally a 6-minute drive away. That's a significant change that a lot of people are dealing with now. And on top of that, Google has really started restricting from an SEO standpoint. It's much, much harder to rank. So back in the day, we could rank nationally. I could have a treatment provider in Florida. We could get them ranking in New York. You can't do that anymore. Even trying to rank across the state of Florida is almost impossible these days from an SEO standpoint. So that means that we have to push out more campaigns and get in front of people in ways that are not search driven, unless we want to pay through the nose for Google ads, which we're not always a big fan of. So those are some of the biggest shifts.
What are your thoughts on AI and it's being used for like marketing and whatnot?
I'm not huge on AI yet. It's great for systems optimizations. Like our team uses it to source research, so we'll just use ChatGPT and say, hey, go find me 5 articles on depression and addiction, right? And so it speeds up the process sometimes. Really good for things like spelling and grammar correction. But at the end of the day, AI from a production standpoint is derivative. At best, all it's doing is it's taking the 5 top search results from Google and then respinning them and reworking them and spitting out the exact same thing said in a different way. That's not valuable from a Google standpoint. Google doesn't want to see spun content. And it's not valuable in like what I'm talking about here in this differentiation. So if I read your blog on depression and addiction, and then I read your competitor's blog on depression and addiction, if they're exactly the same thing, then it still doesn't help me choose you. So not really big fan in terms of how that's operated. And then from a search standpoint, same thing. So people are using AI search a lot more, which is reducing the amount of traffic going to people's websites. So this is causing challenges in terms of the way that people traditionally look at their marketing metrics, because traffic is, an important leading indicator. Right? If I get more traffic, then I should get more calls and I should get more people coming into the program. We're seeing drops in traffic, and it's not necessarily because they're not doing as good in the rankings from an SEO standpoint. It's the fact that Google shows a lot of results without going to the website. You have your knowledge panel that shows the phone number, shows the address, shows basic information. You have little rich snippets that answer questions for you from FAQs where you don't even have to click to the website. And you have AI doing summaries, and giving that information to people, all without them ever having to go to the website. So you're seeing a lot less web traffic across the board than you used to. And again, this goes back to why your display campaigns, your Facebook, your TV, your X, your TikTok, like those campaigns have become more and more important because it's channels to ensure that you're getting in front of people. Whereas with SEO, it's actually becoming harder and harder. So at the end of the day, AI is a tool. It can be useful for speeding things up, but it doesn't create anything different, which is problematic from a marketing standpoint. It doesn't help you separate your business.
Yeah. I always like to ask somebody, if you could go back in time to when you were first starting out, what would be the piece of advice, industry advice you'd give yourself? What's the lesson learned kind of thing?
I'll answer this. And when I first got involved in the space, I was obsessed with performance and data. And that was actually a differentiation component for us back then, because so many marketing companies and agencies and even companies in general, again, they didn't understand social media like we talked about. And so they didn't understand how to measure it or get results. And so the fact that I could track a click to a call to an admission, the fact that I could see how much time people are spending on a page, what parts of the page they're on, like all this insane data that we have these days was a differentiator versus traditional marketers who talk a lot about brand colors and logos and fonts and stuff like that. So I was real obsessed with the data. And I would say nowadays, almost everyone's obsessed with the data. Everyone wants to know what the ROI is going to be for X campaign, and they want to see it tomorrow. So what I've actually changed, and how I would go back and look at it changing, is understanding the importance of committing to intelligent strategies. So like I said, if my audience is on a platform, I should be there. If I'm not getting the results I want, that's because I'm doing something wrong on the platform. It's not because that platform's a bad strategy. But there's no way for me to tell that in the data, right? So what people are saying is they say, okay, I ran a Facebook campaign for 2 weeks and I can't see any admissions that we got off the Facebook campaign. That's misunderstanding how to use data, because you're not. They're not going to click a Facebook ad and then call. They're going to think about you a week later, do a Google search, check out your online reviews, and then call through the website so it looks like it was an SEO search, right? So my data can't give me a granular perspective on bottom line efficacy for a Facebook campaign. I have to measure overall lift. In the same way, say I've got a Google Ads campaign. That's what I've run forever. So a lot of providers, when you first go in, all they run is Google Ads because, again, they're obsessed with the data. And so they're like, well, this we've seen get calls and admissions, but we haven't seen it from Facebook. Well, right. So you have no data on how to run a good Facebook campaign. You have nothing that's going to tell you what works in that space. So, we've got data there, but you don't. So you've got nothing for it to help you. But then also we think about it from an expansion standpoint. So let's say we're just use Nashville again. There are only so many treatment searches in Nashville on a given day, right? There's only so many people that go to Google and search for treatment for high intent terms, like drug rehab near me, counseling services near me, whatever. Once you max that out, there is no more. And so the only way to get more calls is from Google Ads, if we just stay with that platform, is to expand your keyword set. And so now I'm getting into softer terms, like maybe things like, how to manage withdrawal, right? I'm not looking for treatment, but I'm getting in front of someone looking to manage withdrawal that I can maybe convince that might need treatment. Now, that could be a different conversion rate and a different way I need to engage with the patient. Because the patients with high intent, I just need to call, they're looking for a bed. Do you take my insurance? It's a really easy call to handle. But these patients that called because they saw like a managing withdrawals campaign, they're pretty ambivalent about treatment. They're just kind of looking around. So now I need to be able to convince them why they need to get into care and then why our care is the best for them. That's a completely different way of interacting as a call center rep than the first set. But the call center has no data on how to do that, right? They can't look at their data and say, oh, because they'll look at their data and say, well, look, we were usually converting at 30% of our qualified calls. Now we're converting at 15%. These calls aren't good. Wrong. The calls are good, but you need to interact with that patient in a very different way. And again, your historical data is not going to tell you how to do that. So, kind of long answer, but I think helpful for people to realize is strategy and good strategy is not always based in data that you have. You've got to think strategically and smartly and intelligently about what should work. And then if your approach isn't working, it's probably because you're doing something wrong. So then change it up and figure it out until you get it working. Maybe you need to give it more time. Maybe you need more frequency. Maybe you need better targeting. Maybe you need different messaging. Maybe your call center team needs to be retrained to handle a completely different kind of inquiry than they were handling before. All these things.
Now, our audience is wide range there, from people from, that are actually in marketing as well as up to CEOs. I always like to ask a similar question, but if someone was fresh out of marketing school, or they're inspired by this podcast, they want to go into marketing, what would be the one thing you'd want to tell them to kind of prepare them?
I guess I would answer your question in terms of like what would make them successful, which is probably what they want to know. And so my answer would be provide value, right? What is considered valuable in the role that you're in, whether it's graphic design, business development outreach, PPC manager, etc. How do you provide value, not just within the organization, but obviously to the people that you're interacting with, whether that's community referral partners or patients? So many people that I see focus on, like I said, trying to get the conversion through clever wordplay that gets more clicks. That doesn't really drive long-term results. You have to think, what can I get? What is this patient searching for? Or what's this community referral partner need? How can I help them achieve that goal? That's what's going to drive bottom line results for the organization. That's what's going to drive your success in a role.
Now, based off my own past experience, as we've discussed, marketing is kind of nebulous. There's no instant turnaround. There's no, the next day you get 500 more customers kind